The hypothalamus plays a crucial role in regulating the endocrine system by secreting various hormones that target the pituitary gland. These hormones can either stimulate or inhibit the release of hormones from the anterior pituitary. Additionally, the hypothalamus produces hormones that are stored and released by the posterior pituitary. Below is an overview of the key hypothalamic hormones and their targets. Hypothalamic hormones. Thyrotropin-releasing hormone. Function: stimulates the anterior pituitary to release thyroid-stimulating hormone, TSH, and prolactin. Target: anterior pituitary. Clinical relevance: deficiency in thyrotropin-releasing hormone can lead to hypothyroidism, while excess thyrotropin-releasing hormone can cause hyperthyroidism and hyperprolactinemia. Corticotropin-releasing hormone. Function: stimulates the anterior pituitary to release adrenocorticotropic hormone. Target: anterior pituitary. Clinical relevance: elevated levels of corticotropin-releasing hormone can lead to Cushing's syndrome due to excess production of adrenocorticotropic hormone and cortisol. Gonadotropin-releasing hormone. Function: stimulates the anterior pituitary to release luteinizing hormone and follicle-stimulating hormone. Target: anterior pituitary. Clinical relevance: gonadotropin-releasing hormone deficiency can result in delayed puberty and reproductive issues, while excess gonadotropin-releasing hormone can lead to conditions like polycystic ovary syndrome. Growth hormone-releasing hormone. Function: stimulates the anterior pituitary to release growth hormone. Target: anterior pituitary. Clinical relevance: deficiency in growth hormone-releasing hormone can cause growth hormone deficiency, leading to stunted growth in children and reduced muscle mass in adults. Somatostatin, growth hormone-inhibiting hormone. Function: inhibits the release of growth hormone and thyroid-stimulating hormone from the anterior pituitary. Target: anterior pituitary. Clinical relevance: excess somatostatin can lead to inhibition of growth and thyroid function, while deficiency can result in excessive growth hormone production. Dopamine, prolactin-inhibiting hormone. Function: inhibits the release of prolactin from the anterior pituitary. Target: anterior pituitary. Clinical relevance: dopamine deficiency can lead to hyperprolactinemia, causing symptoms like galactorrhea and infertility. Oxytocin. Function: stimulates uterine contractions during childbirth and milk ejection during breastfeeding. Target: uterus and mammary glands, storage and release. Produced in the hypothalamus and stored or released by the posterior pituitary. Clinical relevance: oxytocin deficiency can affect labor and breastfeeding, while excess can lead to uterine hyperstimulation. Antidiuretic hormone, vasopressin. Function: promotes water reabsorption in the kidneys and constricts blood vessels to regulate blood pressure. Target: kidneys and blood vessels. Storage and release: produced in the hypothalamus and stored or released by the posterior pituitary. Clinical relevance: antidiuretic hormone deficiency can cause diabetes insipidus, characterized by excessive urination and thirst, while excess antidiuretic hormone can lead to water retention and hyponatremia.